Today on the CTV News at 5, how a spike in the flu is pushing Alberta hospitals to or above capacity.
We're seeing a lot of cases this year. As I say, it's a higher number than in previous years.
Plus,
by 2018, there would be nothing on this park that would be recognizable to people that they currently see now.
a $91 million overhaul of Lethbridge's exhibition park. And JBS Food Canada will buy the XL meatpacking plant in Brooks.
CTV News with Jackie Scantlebury.
Good afternoon. If it seems like everyone you know is sick or knows of someone who is sick, it could be because they probably are sick. The flu has spread across Canada, with most provinces experiencing a high number of cases. In Lethbridge, the hospital is nearing capacity, and officials are taking precautions to ensure that the flu bug doesn't slow them down. Daryl Rummel reports.
Assisted living facilities put under quarantine, warning signs posted throughout the hospital, signs of an early arrival of flu season. But it's not just any flu. Health officials say it's the toughest strain they've seen in years.
So we are functioning at capacity. We are working very, very hard to kind of continue to make sure that we've got capacity to manage.
So far, surgeries are not being threatened here, but the continued spread of the influenza virus and norovirus could soon change that. And there's an endless stream of patients coming through the doors.
So we've had a number of outbreaks of both, and we know that in the community and also in hospital admissions, we see admissions for both. Influenza, so the respiratory, the cough type of illness, we're seeing an increased number of cases.
Health officials say because they are operating at capacity here at Chinook Regional Hospital, it's important that the community exercises caution when using emergency. They say resources are tied up. And the message isn't don't come to emergency, it's rather exhaust all other options first.
I'm sure everybody knows someone that's sick right now, and so really our message is that there is lots of flu out there, that unless people really need to use emergency, to please consider other options such as phoning HealthLink for advice, phoning family doctors if you're able to, but just really trying to be aware that our services are at a maximum. We need to all kind of work together to make sure we get through this season.
Doctors say the strains we're seeing now are predominantly H3 and A. It's not yet clear if southern Alberta is seeing an early peak in flu cases or if this year will be one for the record books. Health officials are stressing the importance of hand washing in helping stop the spread of the flu, and stay home if the flu bug does bite you. Daryl Rummel, CTV News, Lethbridge.
As more and more Canadians are getting sick, the federal government is taking steps to alleviate a shortage of the flu drug Tamiflu. As John Benavali-Rao reports, Ottawa has opened up the national stockpile.
By now, you've probably already had the flu, or at least know of someone who has. A nasty season sending people to emergency rooms across the country.
We're seeing a lot of cases this year. As I say, it's a higher number than in previous years.
In America, the Centers for Disease Control is calling it one of the worst flu outbreaks in a decade. So bad a hospital in Pennsylvania set up a tent outside its ER to help deal with the influx of patients.
Patients usually come in feeling like they've been run over by a bus. They basically have body aches, joint aches, they feel feverish, they oftentimes have sweats.
And in Canada, the sheer volume of illness has forced Ottawa to step in to avert a potential shortage of the drug used in treating the flu.
There has been a real increased demand and increased prescribing of Tamiflu this year, and that has led to this unexpected shortfall in supply.
Tamiflu can lessen the symptoms of the flu and is often given to seniors, young kids, or those with medical conditions. So much of it is being used, the federal government is dipping into its emergency stockpile to make sure pharmacies and hospitals don't run out before more arrives from the manufacturer in February.
I think it's a good proactive decision because the last thing we would want is to have a period of interruption of supply when we're in the height of a flu outbreak, nationally speaking.
In Toronto, the flu has hit so hard, extra clinics opened up today, with the number of reported flu cases 30 times higher than at this point last year.
We've heard that there's a breakout. It's becoming quite severe, so we thought we better get in and get our flu shots as soon as possible.
In Chicago, hospitals are so overwhelmed, 7 have had to close their emergency room, diverting patients to other facilities. As for advice, public health officials are urging people to get the flu shot. They say it's still not too late, and if it prevents you from getting the flu, you won't, of course, need the treatment Tamiflu.
And the community of Fort Macleod is getting some medical help of its own in the form of a new doctor. A third doctor has just been recruited for the town. The news comes days after another clinic in the community was forced to close its doors last week because of a doctor shortage. Dr. Ann Uwalika will join the Fort Macleod Medical Clinic in the health center and is expected to begin seeing patients within the next couple of weeks. Okay, Dory Rossiter, I admit I have made a mistake. I put my winter boots at the back of my closet, and I think I'm going to have to dig them out.
You're going to have to dig them out, and the broom and the parka and all those good things are going to have to come out. We do expect some snow to hit Lethbridge before dawn tomorrow morning, and then 2 to 4 centimeters during the day tomorrow, 2 to 4 centimeters tomorrow night, and some periods of snow again on Friday. So it looks like Saturday will be the breakout day as far as sunshine returning and clear skies. But until then, yeah, go digging for those boots, Jack.
And I'll dig for that shovel too. Thanks, Dory. Lethbridge's Exhibition Park is undergoing some massive changes under a $91 million redevelopment plan that's being put forward by the organization's board of directors. The plan calls for a new trade and convention center as well as a modern agriplex. Existing facilities would be eventually torn down to make room for more parking and midway space. Terry Boat reports.
This is a total package. More than 3 years of brainstorming, discussion, and planning has come down to this.
The key component.
A proposed $91 million redevelopment of Exhibition Park at its current site east of Henderson Lake.
Final and most difficult piece of the puzzle is that how do you get from design stage to an actual facility that can benefit the community?
One of the benefits, say exhibition officials, is a $63 million trade show and conference center, one that would be large enough to accommodate conventions for between 600 and 2,000 delegates. Conferences the city is currently losing because there are no facilities available.
That's all new events, new activities, new business, and new money that would be brought into the city of Lethbridge that's currently not being brought here at all.
Phase 2 of the project would add a new $16 million agriplex. The plan calls for all of the work to be done over 4 years, starting in 2014. All existing facilities, with the exception of the racetrack and grandstand, would eventually be torn down.
By 2018, there would be nothing on this park that would be recognizable to people that they currently see now.
The conference center would be across the road from Henderson Lake, where the former Henderson campground was located. According to exhibition officials, acquiring that 8-acre parcel of land means they can start the redevelopment without disrupting existing events like Whoop Up Days and Ag Expo. Exhibition Park will be making presentations to a number of groups and organizations over the next few months, explaining the benefits of this project, gathering community input, and trying to gain support. Those meetings will be followed by a presentation to City Council in March, where Exhibition Park will try to convince the city that the redevelopment should be a priority in the 2013 Capital Improvement Plan.
Now it will be left up for us as members of council to prioritize what are the projects that are in the hopper for consideration of capital for the city of Lethbridge, and how does this fall into place.
While city support will be essential, Exhibition Park will be exploring other funding sources as well, including the business community and federal and provincial grants. Terry Vogt, CTV News, Lethbridge.
Now, the project would generate 750 full-time jobs during the construction phase and then a similar number of jobs after the new facilities are up and running. Attawapiskat Chief Teresa Spence has written to the Queen, asking her to send the Governor General to Friday's First Nations meeting. The hunger-striking chief says if David Johnston doesn't go, she won't either. Johnston's office announced yesterday that he would not attend the meeting between Native leaders and Prime Minister Stephen Harper because it is a working meeting on policy issues. Meanwhile, local New Democrats unveiled a new initiative today that they hope will lead to success at the polls across the prairies. The Lethbridge Declaration is a grassroots effort to build NDP support in the 3 prairie provinces and build a strong alternative to the federal Tories by 2015. The party will be hosting regular forums in many communities. Organizers say the campaign is based on a program that was used to win 58 of Quebec's 75 seats in the 2011 election.
We're looking forward to sharing with people a set of practical proposals that certainly put our energy wealth to work for us. And that's certainly something I would like to see in the declaration, and certainly something we're hearing from Albertans.
The Lethbridge meeting will be held March 9th at the Coast Lethbridge Hotel. Well, more than 2 months after it took over management of the XL meat plant in Brooks, JBS Food is buying the company. JBS USA, owned by a Brazilian conglomerate, has bought the slaughterhouse that was ground zero for the E. coli outbreak last fall. We've now learned the plant was cited 6 times for sanitation in the months before the outbreak. Reports show in 2012, inspectors found carcasses touching equipment, products not labeled properly, condensation on rails, and pipes were dripping onto cattle carcasses, and tools and knives weren't properly sanitized. The CFIA says all issues were addressed and followed up in a timely manner, but some critics say they're not surprised by the findings and blame it on inspector complacency.
Anybody would relate to the concept that when people get to know each other, they feel more comfortable, they are likely to trust each other, and I think that's exactly what happened in this case.
At least 18 people were sick from meat traced back to the plant, and the recall expanded to more than 1,500 products. Turning now to the markets, where it was a good one for the day's financial figures. Here are the closing numbers.